Hello, welcome to the ANI community. In this particular video, we are going to discuss the context of the ears or Karna or Shrotra. From the past several videos, we have discussed the context of Bahya Srotas, beginning with Asya or mouth. Later, we have started with the discussion on eyes or Nayana. After that, we have discussed the context of Nasa or nose or nostrils. Today, we are going to discuss the context of ears or Karna or Shrotra. When you think about the Karna, they are actually two Bahya Srotas present in the Urdhvanga Bhaga or head. These are responsible for the proper Shabdajnana or hearing the objects. Tarpaka Kapha and Pranavata, they are helpful in the proper functioning of Shrotra or Karna or ears. When we think about the brief functional anatomy and physiology of ears, they are actually divided into three parts: external ear, middle ear, and inner ear. The external ear comprises the pinna, external auditory canal, and tympanic membrane. Middle ear comprises the ear ossicles and the opening of a, what do you say, that the Eustachian tube. The other opening will be entering or opening in the nasopharynx, nasal cavity. So after that, the inner ear comprises of semicircular canals and the cochlea, which is considered to be the organ of hearing. When you think about the uh, brief physiology, all the sounds they produce they are moving into the ears and external auditory canal that will be sending these signals into the tympanic membrane, which is responsible for the vibration to occur in the tympanic membrane, which in turn is responsible for the vibration of the ear ossicles. After that, this will be creating the vibrations in the organ of corti, that is the hearing. That is what we can say the organ of hearing, where the mechanical energy of this vibration will be converted into electrical energy. From there, it will be entering into the brain, temporal region of the brain. So the Eustachian tube, which is having the, what do you say, that the another opening in the nasal cavity, that is at the inferior nasal turbinate level. This is actually responsible for the proper equalization of the pressure balance, so that in the middle ear, so that the rupture of the tympanic membrane will be prevented. So the in case of the persons who are having the middle ear, that is the nasal diseases as such, they will be having the pain in the ears because of the reabsorption of this particular air from the surrounding tissues of the middle ear. So that's why the person will be having the pain in the ears as such, and some kind of the tinnitus the person may have the may be presented by the patient. The tinnitus means that it is the sensation of the, what do you say, that the abnormal hearing from the person as such. That is what we can say subjective tinnitus as such. The other aspect, the main functioning of the ears, that is the maintaining the balance. Semicircular canals, they are actually responsible for the maintaining the semicircle, that is the maintaining the balance of the body. As far as Nidana of Karna Roga are concerned, Pratishyaya Jalakrida Karnakandu Yanir Marutu. मिथ्यायोगेन शस्त्रस्य कुपितोऽन्येभ्यो मारुतकोपनैः प्राप्य श्रोत्रशिराः कुर्यात् शूलं स्रोतसि वेगवत्. So it is being mentioned that प्रतिश्याय जलक्रीडा कर्णकण्डु यनैर्मरुत् मिथ्यायोगेन शस्त्रस्य शब्दस्य कुपितो अन्येभ्यो मारुतकोपनैः. So according to another aspect, अवश्याय जलक्रीडा कर्णकण्डु यनैर्मरुत् मिथ्यायोगेन शस्त्रस्य कुपितो अन्येभ्यो मारुतकोपनैः. So that is the pratishyaya. When you think about the pratishyaya, it is a spectrum of the disease where the person will be having the nasal discharge or running nose, or where the person may have the nasal blockage, or where the person may have the abnormal smell perception, etc. So that is what we can say the clinical presentation of a pratishyaya. So this actually we have discussed it, how this is responsible for the Karna Roga as such. So that is the Eustachian tube dysfunction, wherein the absorption of the air will be taking place in the middle ear, thereby the person will be having the pain in the ears as such. Jalakrida, so that is swimming or playing in the water, or while taking bath, keeping the or putting the water into the ears. As such, this may sometimes may be responsible for the diseases of the ears. Suppose if the person is doing swimming in the polluted water, naturally there will be a possibility of a Karna Roga as such. Karna Kandu, that is itching in the ears. Suppose if the person is having the wax and he is having itching and he is putting some kind of the pointed objects into the ears so that this wax is going to get eliminated, there may be a possibility of a Karna Roga. So if it is too much pointed, there may be a possibility of a tympanic membrane rupture. That is the next cause as such, Shabda Mithya Yoga. Improper perception of a hearing. Suppose hearing the loud decibel sounds or very low decibel sounds, both are actually harmful to the ears itself. And any other vata vitiating factors as such, which may be specifically leading to the increased vata dosha vitiation in the ears, there may be a possibility of a Karna Roga manifestation. As far as significance of the Karna are concerned, there may be a possibility of entry of dust into the ears. There may be a possibility of entry of water into the ears. There may be a possibility of any other foreign particle, such as the pointed object, can, if that is inserted into the ears, such as earbuds, etc. There may be a possibility of injury to the ears, or the loud sound, loud decibel sound. There may be a possibility of the dysfunction into the ears, or small slap, or that is the very harsh slap into the cheeks. There may be a possibility of the damage to the ears, where the person may not hear the sounds properly. As far as Ayurveda Chikitsa is concerned, Karana Purana, that is putting some kind of the oil into the ears. If it is not being done properly, so no proper the Snehana or Swedana is being done to the ears, there may be a possibility of the Karna Roga manifestation. In a sense, the source of the entry of pathogen in this particular occasion will be ears. Maybe in the form of dust, smoke, or the water, or any other foreign particle such as earbuds, etc., or loud decibel sound. So which may damage the ears, or which may rupture the tympanic membrane, or which may rupture the ear ossicles. Sometimes it may even rupture the or damage the inner ear, etc. So, or there may be a possibility of entry of the pathogen may take place from the other route, alternative route, that is through the middle ear. in cases of nasal diseases, or there may be a possibility of the entry of pathogen may take place from the blood, that is from the carotid artery. There may be a possibility of entry of these pathogens may take place, wherein the source of entry in this particular location will be through the blood. So the in case of these particular entry of these particular pathogens, there may be a possibility of stasis of these pathogens, or proliferation of pathogens may take place in the ears, which may lead to inflammation in the ears. Either there may be a possibility of otitis externa, otitis media, or as such, wherein we are going to observe the intracellular compartment affliction in this particular occasion, wherein the clinical symptoms are related to either external ear or middle ear or inner ears. So the take-home messages from today's discussion are: Karna is considered to be one of the important Bahya Srotas, which gets afflicted in case of entry of rajas or dust into the ears, or improper Karna Purana, wherein there may be a possibility of affliction to the ears may be possible, or the trauma to happen, such as Karna Vyadha, etc., or trauma to the ears, or abnormal the putting the object into the ears, which may lead to the disturbances into the ears. The clinical symptoms may vary from trivial symptoms such as deafness, temporary deafness, to some kinds of life-threatening conditions such as bleeding from the ears in case of head injury, etc. That will be depending upon the number of the pathogens entering into the ears, or virulence of the pathogens entering into the ears as such. Hence, we have to identify the probable cause and eliminate the cause to get rid of this particular disturbances in relation to Karna or ears. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners or true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all from today. Something more in the next video. Thank you.